15 strange early signs of liver failure that even doctors don't know. Did you know that one person dies every 30 seconds from liver-related disease, and most of them never saw it coming? In fact, a 2022 global study found that over 1.5 million people a year die from liver failure, often without a single obvious symptom. So why is that? Well, that's because the early signs don't show up in your liver. They show up in your skin, sleep, mood, even your nails. And most doctors miss them until it's too late. These aren't random symptoms. They're warnings. Warnings your body is sending before the real damage hits. That's why in this video, we're revealing 15 strange early signs of liver failure that even doctors don't know. We will rank them from the least to the most dangerous. And at the very end, the number one sign is so strange, it doesn't even show up in your body. It shows up in your habits. In fact, one major liver study out of Sweden found this single symptom predicted liver failure with over 85% accuracy, years before diagnosis. Before we dive in, let me know in the comments from where you were watching us. Let's start at the bottom of the list with one of the most overlooked early signs. Most people chalk it up to something else, but it could be your liver asking for help. Sign number 15, strange itching without a rash. One of the earliest and oddest signs of liver dysfunction is persistent itching. Not the kind caused by allergies or skin irritation. This itching shows up without a rash, without redness, and often gets worse at night. It usually affects the palms, soles of the feet, or the lower legs. Most people blame it on dry skin or even anxiety. But researchers at the Mayo Clinic found that up to 20% of early-stage liver disease patients reported unexplained chronic itching, often 6 to 12 months before their liver enzyme levels changed. The reason is bile salts. When the liver starts to struggle, it doesn't clear out bile efficiently. That bile backs up in the bloodstream and irritates the nerves in the skin, especially where the skin is thin or sensitive. This isn't surface itching. It's deeper. It feels like it's coming from under the skin, and scratching doesn't really help. It's often worse at night because that's when bile flow slows down naturally as your digestion rests. The danger here is that it's easy to ignore. You treat the symptom with creams or antihistamines, and none of it works because the problem is internal. If you're over 50 and dealing with strange itching that doesn't respond to lotion or allergy meds, your liver needs a closer look. The best thing you can do is get a full liver function panel, but don't stop there. Ask your doctor to check your bile acids and GGT levels specifically. These can rise before standard liver enzymes like ALT or AST change. And while you're getting tested, help your liver by reducing your toxic load. That means no alcohol, no unnecessary medications, and cutting back on ultra-processed food. Drink more water. Add foods rich in glutathione precursors like asparagus, avocados, and spinach. These support detox pathways and can ease the backup that causes the itch. The earlier you respond, the easier it is to stop the damage. Sign number 14, sudden sensitivity to smells. If you've recently noticed that everyday smells, like perfume, gasoline, or cooking oil, suddenly feel too strong or even make you nauseous, your liver may be behind it. This symptom is easy to dismiss. Many people blame it on aging, hormones, or even anxiety. But there's a deeper connection to liver health. Your liver is the main detox organ in the body. One of its jobs is filtering out volatile organic compounds, those chemical particles that create strong odors. When your liver is struggling, it doesn't filter those volatile organic compounds efficiently. They build up in the bloodstream, making your body more reactive to odors you'd normally tolerate. A 2018 study published in the Journal of Hepatology followed 522 patients with non-alcoholic fatty liver disease. Nearly 22% of them reported increased sensitivity to smells during the early stages of liver dysfunction. The study found a clear pattern. The worse the liver function, the stronger the odor sensitivity became. This hypersensitivity is your brain and immune system reacting to toxins your liver can't keep up with. This sign can show up early and linger for months or years. It can cause headaches, nausea, and even aversion to foods you once enjoyed. People often find themselves pulling away from social events or restaurants because smells overwhelm them. It can quietly impact your life without you realizing the cause. To support your liver and reduce this symptom, you can start by lowering your chemical exposure. Switch to natural cleaning products. Avoid scented candles or air fresheners loaded with synthetic compounds. And most importantly, eat more cruciferous vegetables like broccoli, Brussels sprouts, and arugula. These boost glutathione production, your liver's master detox antioxidant, and help neutralize volatile organic compounds before they build up. Sign number 13, feeling hot or sweaty for no reason. Excess sweating or feeling overheated when others around you feel fine can be an early warning sign of liver dysfunction. Your liver plays a critical role in regulating body temperature. When it's inflamed or under stress, it can send false signals to your hypothalamus, the part of your brain that controls body heat. As a result, your body might overreact by opening your sweat glands or increasing blood flow to the skin, even when there's no heat to trigger it. In a 2019 clinical study from the University of Copenhagen, researchers tracked 389 adults with early-stage cirrhosis. Over 30% reported episodes of unexplained warmth or nighttime sweating, even though their blood tests appeared mostly normal. The liver inflammation was triggering changes in cytokine small proteins that regulate immune responses and body temperature. Elevated cytokines were found in nearly every patient experiencing these strange temperature shifts. You might feel flushed, damp, or uncomfortably hot at night. You might think it's hormonal, especially if you're postmenopausal. But if these symptoms don't respond to usual treatments and show up without fever or infection, your liver could be the culprit. To cool down the inflammation, reduce sugar and saturated fat intake. Both fuel liver stress and cytokine production. Drink dandelion tea, which contains liver-friendly compounds like taraxacin and inulin, and increase your intake of omega-3s from flaxseed or wild salmon to help rebalance your immune response and reduce inflammatory heat. Sign number 12, random nosebleeds. Occasional nosebleeds might not seem serious, but if you're getting them more often than usual, your liver could be struggling. The liver helps make the proteins that control blood clotting. When liver function drops, even slightly, your ability to clot decreases. Blood vessels become more fragile. The tiny capillaries in your nose are especially sensitive. And if they rupture more easily than before, that's a sign your clotting factors may be off. A 2021 study in clinical liver disease reviewed 476 patients with early fibrosis. The study found that 17% of them had recurring nosebleeds that were unrelated to trauma, medication, or dry air. Blood tests showed mildly low platelet levels and slight drops in clotting proteins like prothrombin, both early signs of liver impairment. These changes often appear before traditional liver enzymes rise, making them critical for early detection. If you've noticed frequent nosebleeds, especially at night or after mild irritation, don't ignore it. You may also notice more bruising or slower healing from cuts, other signs your clotting is affected. To help restore balance, eat foods rich in vitamin K1, which supports clotting and is often low in people with liver stress. Leafy greens like kale and spinach are excellent sources. You can also add natto or fermented vegetables for vitamin K2, which helps regulate where calcium and clotting proteins go. And stay hydrated to keep your blood vessels flexible and less prone to rupture. Sign number 11, sudden personality changes. It might sound strange, but if you or someone you know starts acting oddly, more irritable, withdrawn, anxious, or confused, it could be an early sign of liver trouble. The liver doesn't just handle digestion. It filters toxins that affect your brain. When it slows down, ammonia builds up in your blood. Ammonia is toxic to the brain. Even a slight increase can change how you think, feel, and respond to people around you. A 2017 study in hepatology research followed 248 adults with early liver dysfunction and found that 26% showed subtle cognitive changes long before blood tests confirmed advanced disease. These weren't dramatic breakdowns. They were small shifts, trouble focusing, mood swings, a short temper that didn't match the situation. Friends and family often notice the changes first. This is known as minimal hepatic encephalopathy. It doesn't mean you're losing your mind. It means your liver is struggling to clean your blood. and your brain is reacting. The risk is that it can worsen fast if ignored. To protect your brain, start by cutting back on protein from red meat, which produces more ammonia when digested. Switch to plant-based proteins like lentils, tofu, and chickpeas. Add prebiotics like oats and bananas to support the gut-liver-brain axis. And stay mentally active with puzzles, reading, or learning something new daily to keep your brain sharp even under stress. Sign number 10. Changes in eye shape or movement. Your eyes can reveal early liver damage in ways most people, and even many doctors, miss. It's not just about yellowing, which is more obvious. Some people develop subtle changes in the way their eyes move or even the shape of the eyelids. You might notice tremors when tracking moving objects. You might feel slower when shifting your gaze from side to side, or your eyelids might appear droopy without any injury. This symptom is linked to a specific condition called Wilson's disease, where copper builds up in the liver and brain. But even outside of that, sluggish liver detox can affect eye muscles by impairing the brain's basal ganglia, areas tied to motor control. A 2020 paper in Neurology and Liver Function tracked 142 patients with unexplained eye movement changes. MRI and liver enzyme tests later confirmed that 61% of them had underlying liver damage. If your eyes feel strained, slow, or just different, and it doesn't match vision loss or dry eyes, this may be a deeper issue. Keep track of any light sensitivity or difficulty focusing during motion. These are subtle signs of neurological strain that can be liver-related. To help, support both the liver and nervous system. Eat foods rich in choline like eggs, cauliflower, and sunflower seeds to help repair nerve pathways. Avoid excess copper from supplements unless advised by a doctor, and get a liver scan if you notice other signs alongside these changes. Sign number 9. Sour breath in the morning. Morning breath is normal, but a specific, strong, sour, or musty smell from the mouth, especially if it lingers, can point to liver distress. Doctors call this fetor hepaticus. It happens when the liver can't filter sulfur-containing compounds from your blood. These compounds get exhaled through your lungs, producing an unusual smell no amount of brushing can cover up. This is more than a hygiene issue. It's a metabolic warning. A 2021 study published in the Journal of Clinical Gastroenterology found that 14% of patients with early-stage liver fibrosis had persistent sour or metallic breath that preceded major symptoms. In many cases, liver enzymes were only slightly elevated or even normal. The breath was one of the first signs something was wrong. The odor is usually worse in the morning after a night of liver rest, since detox slows while you sleep. If your breath smells sour or like raw meat consistently, even with good dental care, your liver may not be keeping up. You can ease this by eating more sulfur-binding foods like parsley, cilantro, and green tea. Drink water with fresh lemon juice in the morning to support liver bile flow. And limit alcohol, which damages liver filtering and makes the problem worse over time. Sign number 8. Thin, ridged, or curved fingernails. Your nails can quietly reveal what your liver is going through long before any blood test does. If you've noticed your fingernails getting thinner, developing vertical ridges, or even curving downwards slightly like spoon shapes, your liver might be signaling early distress. These changes happen when protein synthesis drops. Your liver is responsible for producing albumin and other essential proteins that help build and maintain tissues, including your nails. When liver function slows, the body starts pulling protein from non-essential structures to protect vital organs. Your nails are among the first to show it. A 2019 observational study from Hepatic Medicine followed 312 patients with early liver fibrosis. Over 35% had visible nail changes, most commonly vertical ridges and thin, brittle edges. Another 18% showed curvature that doctors originally misdiagnosed as iron deficiency. It turned out that even with normal iron levels, their liver's protein output was dropping. These nail changes are slow but steady. They don't reverse easily without addressing the root problem. You may also notice white spots or a pale, washed-out nail bed, all tied to liver-related nutrient loss. To rebuild, increase intake of complete proteins like eggs and quinoa. Add zinc-rich foods like pumpkin seeds, which support nail growth and liver repair. And consider a supplement with biotin and milk thistle only under medical advice, as they can support regeneration but interact with medications. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Sign number 7, sudden food aversions. Imagine biting into a food you've always loved, like eggs or meat, and suddenly feeling repulsed. The smell, the texture, even the thought of it makes you feel sick. You haven't changed, but your liver might have. One of the strangest early signs of liver dysfunction is the sudden development of food aversions. These are not allergies. They're sensory rejections your brain creates as a protective mechanism when your liver is overworked. A clinical review in Liver International found that 22% of early-stage liver patients reported developing strong aversions to high-protein foods. Eggs, fish, and red meat were the top triggers. These foods are harder for the liver to break down, especially when bile production drops. The brain begins associating them with nausea or discomfort and creates an aversion to prevent further stress. This isn't just psychological. It's biochemical. The body is trying to protect itself, but the danger is that you stop eating key nutrients your body still needs, like B12 and choline. That can make liver repair even harder. To balance this, replace the aversive foods with easier-to-digest protein sources like lentils, chia seeds, or bone broth, and eat small portions, slowly. This helps your system adjust without overwhelming your liver or triggering more rejection signals. Sign number 6, sudden sensitivity to medications. If a medication you've taken for years suddenly causes side effects or feels stronger than it used to, it may not be the drug. It may be your liver slowing down. The liver breaks down almost every drug, vitamin, or supplement you consume. When it starts to fail, that process backs up. Medications stay in your system longer, and even standard doses can become toxic. A 2020 review published in Clinical Pharmacology and Therapeutics showed that early liver dysfunction reduced drug clearance rates by 24% on average, and in some cases up to 40%. That means a drug your body used to handle in 6 hours now lingers for 8 or more. The result is more intense side effects, slower recovery, and sometimes even liver damage from the medication itself. It becomes a vicious cycle. You may feel dizzy, nauseous, overly sedated, or experience rashes and headaches that never happened before. If this happens with 2 or more medications, even over-the-counter ones, it's time to investigate liver function, especially if your ALT, AST, or bilirubin levels are creeping up, or if your skin is getting itchy or your urine turns darker than usual. To protect yourself, talk to your doctor about adjusting dosages. Avoid acetaminophen, which is metabolized in the liver and can be especially dangerous in high or frequent doses, and support detox with leafy greens and high-fiber foods that help carry waste and drug byproducts out of the body faster. Sign number 5, unexplained weight loss or loss of muscle mass. If you're losing weight or muscle without trying, especially in your arms, thighs, or face, your liver might be struggling in silence. This is called sarcopenia, and it's one of the earliest ways the body responds to liver dysfunction. Your liver controls protein synthesis and nutrient metabolism. When it begins to fail, the body enters a catabolic state, meaning it starts breaking down its own tissues for energy. A 2022 study in the Journal of Cachexia, Sarcopenia and Muscle tracked 408 patients with early-stage liver disease. Nearly 40% showed measurable loss of lean muscle before their liver numbers even raised concern. That's because the liver wasn't converting protein efficiently. Instead of building tissue, the body began breaking it down. What makes this so dangerous is that many people see weight loss as a good thing until it turns into frailty, fatigue, and imbalance. If your clothes are looser, your grip is weaker, or your muscles feel softer even with regular meals, it's time to ask if your liver is part of the problem. To fight back, increase high-quality protein intake in smaller, frequent portions. Use whey isolate, bone broth, or plant-based protein blends. Add resistance exercises like squats, wall push-ups, or resistance bands. Even 10 minutes a day can help rebuild mass. and add magnesium and B-complex vitamins to support liver metabolism and muscle repair. Sign number 4, swelling in the right side of the abdomen. Your liver sits just under your right rib cage, so if you've noticed a strange fullness, heaviness, or bloating on that side, especially after meals or when lying on your right, it could be inflammation or early swelling of the liver. This is called hepatomegaly. It's one of the first physical signs doctors look for, but patients often notice it before doctors do. It doesn't usually hurt, but it feels like something's pushing out against your ribs. A 2019 study from Gastroenterology Research scanned 615 patients with fatty liver and mild fibrosis. A full 28% had palpable liver enlargement before their lab work raised red flags. Most described it as a vague pressure on their right side, not pain. Some even thought it was gallbladder-related or just gas. This swelling comes from fat accumulation and inflammation. The liver expands, compressing surrounding tissues. Over time, this can restrict blood flow and worsen damage. To respond, cut sugar and refined carbs immediately. These are major causes of fatty liver and inflammation. Replace them with low glycemic foods like berries, leafy greens, and legumes, and increase daily movement. Even walking 20 minutes a day helps reduce liver size and inflammation faster than medication alone, according to several clinical trials. Sign number 3, orange or brown urine in the morning. Your liver filters out waste through bile, and that bile exits your body through your stool and urine. When your liver starts failing, bilirubin, a yellowish pigment, builds up in your blood and ends up in your urine. It darkens the color, especially in the morning when your body is most dehydrated. This can be one of the very first external clues that your liver is backed up. In 2021, researchers in Annals of Hepatology tested 980 patients with early-stage cirrhosis. One-third of them reported unusually dark urine months before showing major symptoms. Their bilirubin levels were elevated, but within the normal range, something even many doctors overlook. If your urine is orange, dark yellow, or tea-colored in the morning and stays that way even after hydrating, your liver could be involved, especially if it's paired with pale stool or itchy skin. To flush bilirubin and support liver flow, drink warm water with lemon or apple cider vinegar first thing in the morning. Stay away from high-sodium foods, which put extra stress on the liver and kidneys. And make sure you're not overusing medications like NSAIDs or Tylenol, which can worsen bilirubin buildup without warning. Sign number 2, pale or clay-colored stools. When your poop loses its color, your liver might be losing its grip. Normal stool gets its brown tone from bile, which the liver produces. If your bile ducts are clogged or your liver isn't producing enough bile, your stool turns pale, yellow, or even clay-colored. This may sound trivial, but it's actually one of the strongest indicators that your liver's bile flow is blocked, and that needs urgent attention. A clinical review published in B&J Open Gastroenterology in 2020 tracked 328 patients with undiagnosed liver obstruction. Over 70% reported weeks or months of pale stools before developing other symptoms. Most had no pain, no yellowing, no nausea, just a strange, light-colored stool that never seemed to return to normal. Doctors often miss this unless the patient reports it clearly, so it's critical to watch for it yourself. A single pale stool isn't the issue, but if it happens 2 or 3 times in a week and you've ruled out medications like antacids or barium, call your doctor. Bile is essential for digestion and detox. Without it, your entire digestive system slows down and toxins start circulating back into your bloodstream. To support bile production naturally, eat bitter greens like arugula, mustard greens, and dandelion leaves. These stimulate bile flow and help clear out the ducts. Add small amounts of healthy fats like olive oil and avocado to keep the bile moving, and avoid deep-fried foods, which can thicken bile and block ducts even more. Sign number 1, waking up at 2 or 3 a.m. regularly. This one's strange, and most people would never connect it to their liver. But waking up like clockwork between 2 and 3 a.m. may be your body's way of telling you something's wrong. According to traditional Chinese medicine, this time window is tied to liver function, but modern science backs it up. The liver's detox cycle ramps up during these early hours. If your liver is overloaded or inflamed, it disrupts your sleep through nervous system activation, blood sugar dips, or cortisol spikes. A landmark 2018 sleep study published in Sleep Science analyzed the sleep patterns of 647 adults with early liver damage. Nearly half of them reported waking around 2 or 3 a.m. most nights. Many had no insomnia history. Their blood sugar was stable, but their liver enzyme levels and cortisol patterns showed irregular detox responses. This sleep disruption often showed up 6 to 12 months before their formal diagnosis. You might wake up anxious, sweaty, or with a racing mind. You may toss and turn until 4 a.m., then crash again, only to feel drained the next day. If this is happening more than twice a week, it's time to look at your liver. To reset your rhythm, stop eating 3 hours before bed to reduce overnight liver workload. Avoid alcohol completely, and add liver-supporting herbs like milk thistle or turmeric under guidance. Deep breathing or meditation before bed can lower cortisol and help your liver catch up on its nightly work. Now you know the truth. Your liver doesn't wait until it's too late to send a warning. It whispers first, in your skin, in your sleep, in your mood, your bathroom habits, and even your breath. These 15 signs might seem strange, random, or harmless on their own, but together, they could be your body's only chance to speak before the damage becomes permanent. The liver is silent, but it's vital. It filters your blood, processes every pill, every bite, every toxin you're exposed to, and once it starts to fail, everything else fails with it. The terrifying part: most seniors don't realize what's happening until they're facing hospital visits, painful procedures, or lifelong complications. But you're not most people. You watch this, you now know what to look for, and you can act early, smart, and with purpose. So, take a moment. Ask yourself, have you seen any of these signs? Don't ignore them. Comment below and tell us which one shocked you the most. Like this video if it opened your eyes, and subscribe right now for more life-saving health advice, because the next video might just save your life. If you have any questions or want to share your own experiences, feel free to leave a comment below. Thanks for watching.